I remember there was one organization we were working with, and it was like a healthy cooking class. And they were doing a good job. They had all the fruits and vegetables and how to do this raw and how to do this cooked and what this is like, and then how to shop with your WIC and your SNAP benefits. But one woman stopped in the class and she was like, "Excuse me, I only have a microwave in my home." And just like that shift of from equality to equity, and that is how we need to proceed as a society, because we know we're not all on the same page or starting point or have the same privileges. So with just learning through people's learned experiences, and truly just being a listener, that is really what opened my eyes to
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 31. Hi, everyone. My name is Omari Richens. Thank you so much for joining me today. I appreciate you all tuning in today. I hope that you all are doing well, staying safe, and taking it easy during these holidays. I know that's a tough time for a lot of us, and just make sure you're taking time for yourself to stay healthy. Make sure you're staying physically active, mentally active in some way. And just make sure to take care of yourself. But this episode has a lot of value. I really like this story and how it's just a non-traditional public health story coming from like a public relations communications background, and how she really didn't know public health, but public health was the thing that was calling her, and her path towards it was pretty awesome. And I think that you will find this interview very informative. So without further ado, here is today's episode. Today, we have a public health and risk communications professional dedicated to advancing health education, creating sustainable social and environmental changes, and passing policies to improve health outcomes. She got her Bachelor of Communications and Public Relations at Xavier University. She has done freelance photography, design, and public relations since 2007. She was the Associate Technical Director for Xavier University before going on to get her Master of Public Health at the University of Florida. Go Gators! Since then, she has been community health educator, health communication specialist, and senior manager of external relations at the Health Collaborative. She now works as assistant director for emergency response and PIO for the Health Collaborative. We have Christa Hyson, MPH. Welcome to the show.
Thank you for having me.
Yeah, it's my pleasure. Like when I started the show, like you were one of the people that I wanted to have on the show just because that one time when you came to UF to talk and your presentation, it just really stuck with me. So I just just put that out
Oh,
there.
thank you. That's so sweet.
Yeah, so I'm just glad that I came full circle and actually reached out to you to be on the show. So I'm
Yeah,
happy to have you here today. How are you doing and been coping during these times?
that's a question. Um, Happy March 485 to everyone. It's very interesting. Even where I work, some people's calendars are still on March, because some roles have become permanently, virtual, and it is such an interesting world. I know, like when you get your MPH at UF, they kind of talk about big picture ideas, especially within your epi classes of like, this was the 1918 pandemic, this is what happened. And I'm like, wow, like literally everything's happening, from the misinformation to the harassment of healthcare professionals to all those things. I was like, we haven't come too far in 100 years, but at least we have the capability to remote learn, come up with a vaccine a lot faster because we're relying on different types of methods and things that have been worked out. So it's been a very interesting 9 months working both in emergency response and public information. So it's kind of like the worst of times with both roles
Yeah, I
and
completely
challenging.
understood. Yeah, I tip my hat off to you and thank you for the hard work that you're doing. We really appreciate it.
Thank you.
Yeah, and it's funny that you said that you talking about any epi classes, the same sorts of things happened years ago. Like people are the same. It's just technology has advanced, and
Mhm.
the technology hasn't advanced in the best ways, with a lot of misinformation being spread out there. And yeah, but we don't have to talk
Yeah.
about it right now. So tell me, how do you identify and tell us a little bit about your background?
um, I identify right now as tired. Uh, is the best way I can say it. I mean, in the beginning, right when things started happening, the first weekend I worked was actually the weekend of the Super Bowl because I was at my friend's Super Bowl party and I got a work call talking about, all right, you need to call in for this press conference because Miami University, which is located in a little bit north of Cincinnati in Oxford, they had students returning from a study abroad and they were in Wuhan. And both of these students had cold-like symptoms and things are starting to come out the end of January, beginning of February. So, this is when there was no testing mechanism. There was no testing medium. It was not a normal lab test. So you had to collect a specimen, get it to a special place, make sure it made its way to Atlanta. And then the CDC confirmed and okay. Luckily, they were negative. But ever since then, it's been nonstop. Um, it has been a both humbling experience, but then also I'm a firm believer that God puts you where you need to be and you use those skills and talents to the best of your ability. So I grew up doing theater a lot in grade school, high school, and college, and I never thought an improv class I took in college as like I need another credit would be so valuable because I am constantly in front of the camera. I have to speak well on my feet. I have to know a little bit about everything because I think the most challenging part of this pandemic and why the amount of frustration has come the way it has come is that I don't know isn't an acceptable answer to the American public. It's not. And that's, hard when I just have to remind people I'm like, listen, we're still developing a vaccine for so many diseases. We just now have PrEP or pre exposure prophylaxis. Um, we are now learning so much more about HIV than we did 30 years ago. But keep in mind, 30 years. We have known about this for, about 9-ish months. Let's say the American public has been COVID deep 9 months. We cannot expect our scientists, our epidemiologists, our researchers, doctors, whoever, to be experts in a disease that is brand new. And it's hard when people have questions, and the answer is, I don't know. I mean, at first, the incubation period was, well, it could be up to, 28 days. Now we're hearing 5 to 21. Now we know it's a little bit closer to 5 to 14. But that message change is very confusing for people that aren't in the public health world. Like for us, we're constantly like evidence-based. Give us what we need to do to move forward. But when we don't have those peer-supported or evidence-based models to rely on our practices with, it's hard. And it's like wear the mask, don't wear the mask, step away. Oh, well, I live with someone, they didn't get it. What happened to me? And then you have to go into the details of, well, the timing of the test. Did you test too early? Did you test too late? What was the viral load replication within your body? So many ways, but a roundabout way to answer your question of tired.
Well, thank you for sharing that. That was actually very insightful. And I appreciate your roundabout way. And I never really thought about like how improv can play out in public health and how it can help you in just like public speaking and that. And that was cool for you to point out. So thanks for pointing that out. So what does public health mean to you?
That's a hard question. I think I mean, I know for sure it's a calling. Like a couple weeks ago, I was just really stressed. I had lost someone due to COVID, and I was just at my wit's end. And I was telling my mom, I was like, I don't know how to make other people care about other people. That shouldn't be a conversation. Like, wear a mask. Simple as that. But it has become a very political symbol. And my mom asked me, she's like, do you regret like going into public health? And I know she was kidding. But I was like, there's not a day that goes by that getting my MPH was the best decision I've ever made. Little did I know that every little career choice or move or internship was all pointing towards public health. I started out actually in criminal justice, and then I was like, I don't know. But then I transitioned to communications because I've always been more artsy and theater and creative. And I was like, okay, communications is broad enough. But then I constantly found myself like taking on like healthy initiatives with like 52100 and with like kids and or obesity or substance use and abuse programming. And I was like, okay. And it actually clicked for me. One day I was working at Landstuhl, which is the level 1 trauma center in Germany, because I was working for the army at the time. And I was a DoD civilian. I didn't wear the uniform or serve or anything. But I kind of saw high level, because we would see a lot of soldiers come in with certain medical problems that were across the board very frustrating. So either younger families that were having trouble with SNAP benefits to just overall substance use and abuse issues. And you would just see these small issues. And then when you look a little bit bigger, start to identify these themes and populations. And I had always wanted to go to grad school, but I was a little unsure. And one of the doctors that I was working with at the time, I just worked on like ER screening, very basic. And he's like, you've got a population mindset. And I'm like, I don't even know what that means. He's like, you need to go to school for public health. I like Googled it and I was like, I just never had a name for what I wanted to do. And because people, I don't know if you get this to this day of like, oh, I work in public health. They're like, oh, you're a nurse. And I'm like, oh, bless them. But no, we do something totally different. And it's hard to explain, those policies and those systems and those environmental changes. I also try to explain to people that, we aren't noticed when we do a good job. So that pregnancy that was prevented, that seatbelt that kept you in the car, the air that you breathe is clean, the water that you drink is clean, all those things. It's when things go wrong, like, I don't know, a global pandemic, when exacerbations are seen, and that's when things get tough.
Yeah, absolutely. Thanks for sharing that. And yeah, I appreciate that. So, well, I guess I'll ask you about that a little later on. So you got your Bachelors of Communications and Public Relations at Xavier University. So what was the thought process for getting this degree?
I wanted something general enough to be able to go to grad school somewhere. But then I also like the creative aspects of it. But then I also really like the sociology behind. So like, what makes a consumer think about what to buy? And that type of thinking and that sociology background has come in so handy, especially when working on programming with health behaviors. Like, what does it really take to have someone stop smoking? Mm-hmm. Like, I think the average is you quit 7 times before you actually quit the last time. And just like, what are those incremental changes that you can make in your life that, executes into a healthy lifestyle or behavior?
Okay. Yeah, and I guess that does make sense, that you wanted something general to go into grad school. So your thought was always grad school, you just didn't know what for, right?
Yep. I was like, whatever it is, I'm going to be very specific. And then as we both know, public health, you can literally do anything with it. So
Mhm.
here I am again. Who knows?
Okay. So when throughout your undergrad time did you get like interested in like sociology or like getting those kinds of things, those public health themes coming at you?
I'd probably say, so Xavier is a Jesuit school, so a lot of our theology classes, we also had to back up with some service hours. So seeing um, just different populations that maybe you weren't used to as a child, or this is your first time, away from home, and you are seeing how different people live and how different people commute. Um, I remember there was one organization we were working with, and it was like a healthy cooking class. And they were doing a good job. They had all the fruits and vegetables and how to do this raw and how to do this cooked and what this is like, and then how to shop with like, your WIC and your SNAP benefits. But one woman stopped in the class and she was like, "Excuse me, I only have a microwave in my home." And just like that shift of from equality to equity, and that is how we need to proceed as a society, because we know we're not all on the same page or starting point or have the same privileges. So with just learning through people's learned experiences, and truly just being a listener, that is really what opened my eyes to
Okay. Awesome. That was really that's also very insightful. You're saying very insightful things today. So I appreciate the tiredness. So during your undergrad, you also had the web designer for
that.
Debunkify as
Yeah.
Project U campaign through Northlich Ad Agency. So do you want to just talk a little bit about this?
Yeah, so in our PR class, we had to utilize an actual campaign. So back in the day, I don't know if you remember the ads that were like the hand and it said stand on it. It was like the old like stand up, speak out against tobacco campaign. So we had to run a qualitative and quantitative study on college students and smoking habits. And we just track different data and designed it through actually Northlick, which was the ad agency that we were partnering with at the time. So we got to learn like baby coding, like very, very, I mean, I'm dating myself, but like it was when the facebook.com, you had to have a .edu email address to join, because we were like I don't know, the lab rats for the initial public release outside of Harvard. So we're going to use the Facebook to do survey data on smoking. And it was like, what a world. So, I mean, that was a good experience, but then it also, was another one of those little stepping stones onto looking at health behaviors and ultimately, situational change and policy changes that come after that.
Okay, that's awesome. I find it so fascinating that like you're in this degree that is nothing to do with public health, but you're finding all these public health things. And I feel like
Exactly.
there may be like so many other people out there who might have that same kind of pulling and drive to be in a field where you're helping people, but they just don't know about public health, you know? So it's great that you were able to find public health and shape your path towards that. And I hope that more people are able to do that same thing coming from like non-traditional backgrounds in public health, because I think it's so important to have the different perspectives. So you also started your freelance photography, design, and public relations and SEO business around this time. So what made you want to start this?
I am super, super lucky, because I had help from my parents, help from grandparents, and then I also worked. I had a work study job too during college. But then I also, just photography is just something I've always loved as a child. And I found out that you could make a decent amount of money I did weddings and babies and senior pictures and all these things. So I would run people's social media because it just came easy. and helped a lot of people with like Google AdWords and things like that. And it's just such a good tool to have in your toolkit. But then also, I have no college debt. So I'm super lucky, but I did work my booty off.
Well, I bet that you appreciate that now there, and that's awesome.
Oh
So
yeah.
how has this freelance photography like taken place like throughout your entire career? Like how has it ebbed and flowed?
Yeah, it's just something I'll say like more recently. I haven't been doing it. I did a little maternity shoot for my friend that got pregnant because she's like, I know you're safe. And we still wore masks and everything to take photos. But yeah, it's just something I kind of like to keep in my back pocket in case it's needed. And, you know, it's very, it's one of those skill sets, whether it's like coding or design or graphics, just one of those things because you realize real quick that, especially if you work for a health department, public health is poor. We are very poor. And we don't get a lot of support, such as like graphics or communication. Sometimes like the health promotions department, you are the content editor, you are the graphic designer, you are the photographer, and you are the spokesperson. So it's good to have all those skills that you can translate to support areas that may not have the grant opportunities or funding. So I would say, you know, especially for people in college, you know, like see where your hobbies kind of take you because you never know how those can be assets later in your career.
Yeah, that's great advice right there. So you graduated from your bachelor's and then you got this job as a digital imaging marketing coordinator photographer for BHDP architecture. So how did you
Yeah.
get this and then what did you do in it?
So hindsight 2020, right? Ooh, very bad omen for this year. So I had a photography portfolio, and being a new graduate, I was like applying everywhere. And this is back in the day when they still accepted like handwritten like resumes, like you could print them off and turn them in. And I remember being like, oh no, I'm gonna send a PDF of this. So I like had sent like a digital portfolio and they loved it. Hindsight, maybe shouldn't have taken a job with an architecture firm in the fall of 2008 because it's not like there was any housing collapse or recession. So yeah, so the reason I keep that job on there to show people that even if you were laid off, it is not the end of the world. Does it feel like the end of the world when you're 22, you live on your own and you don't know how you're going to pay for rent next month? Yeah, it's terrifying. But I actually was really fortunate and I went back to my work study job at the Cintas Center, which is on the campus of Xavier University. And I was like, listen, I got laid off. They're like, yeah, come back, no problem. Like, let's make it happen and we'll float you until you find a job. So at least I had an income. It was like $7 an hour, but you know, it's better than nothing. So it's scary and you learn a lot, but I really, you know, admire that I got through it in the way I did because I've had and known people that have been laid off and they, you know, take it very personally. And it's like it's at the end of the day, unfortunately, it's just business. And just like in public health, sometimes when a grant runs out, it's like, well, that's it, funding got cut. And to be resilient and to be creative. So when you rely on those talents and rely on those hobbies and never ever burn bridges when you leave jobs, like my old boss welcomed me back with open arms and said, hey, come on back, you'll find something. And I did. So
Okay, awesome. Well, thanks for sharing that. And yeah, you definitely were resilient there, and definitely goes to speak to how you didn't burn those bridges and you kept those relationships there. And I guess you did good work also, so they were willing to take you back even though you left. So what was that process like for you to go back to this job and then have to look for like a more permanent role? What was that like?
it was humbling because I was graduated working with college kids. So um, you work hard, you take the dirty jobs, and you do what you need to do to get by. So, I mean, it was an awesome job. I was doing technical direction, so anything from like stage setups, audio and graphic setups, running wires, crawling under stages, plugging in XLRs, and but here's the thing: when the projector goes down in the conference room, I can still rewire it and fix it. So again, another like job that you're like, I won't need this, but let me tell you, AV, awesome to have that in your background too.
Yeah, awesome. That is awesome. Definitely, I should be putting that on your resume. Make them know that if the projector shuts down, Krista's got it.
Mm-hmm.
So after you had this period, you landed a role with as associate technical director at Xavier University. So how do you come across this role, and like what did you do in it?
So that is the role they transitioned me into after I had worked a little bit and I still hadn't found a permanent role. So my old boss gave me a little bit of a promotion, so that was nice. But yeah, it's definitely holding on to those relationships.
Okay, awesome. So what did you do in this role?
So this was more of oversight of all the individuals doing that work. So the people making sure that, especially with large scale events, so we would have speakers that would attract 10,000 people. I think one of the biggest speeches I worked on, it's kind of a weird person to mention now, but Bill Cosby, he came to the arena. So it was just so much like making sure everything was perfect, testing all the lighting, testing all the audio. He had 4 mic packs and we would have to switch them out behind the chair, and just making sure that everything runs smoothly. Again, kind of like public health, you don't know the AV tech crew is there unless there's a mic hitting a sharp note or something sounds off or the mic goes out. We want to not be noticed.
That was a great analogy. Great analogy. So I think at this point in time is when you transitioned to your testing examiner educational counselor at the U.S. Army. So like, what was going through your mind to want to do this role?
Yeah, so I have always been someone that wanted to serve my country, but in a little bit different way. I'm a tiny little person. I wasn't really about learning how to use a gun or anything like that, but I wanted to serve those that serve. And an education opportunity came up, and it was to help soldiers that were either transitioning or getting what is called a merit promotion or going and getting certain certifications. So I ran what was called the DLAB, the DLPT, and the OPI. So DLAB is the Defense Language Aptitude Battery, the Defense Language Proficiency Test, and the Oral Proficiency Interview. So acronym soup. So you also need to learn a whole nother language. But yeah, so working with guys that would be, take for example, 18 alphas, which are special forces that would drop into certain countries. They would be taking language tests and aptitude tests and oral tests on the phone to make sure that their accent was correct. They knew the language backwards and forwards, because if you're doing, let's say, things that require a higher level of operational security, you best be speaking like a local. So I worked with guys in their education of pursuing foreign languages, but then also those that were transitioning out of the Army. I would help them. It's called a JST, a Joint Service Transcript. So I basically go, okay, you have this class from the Army. This is what it equals in the civilian world, so that they could then go to any college and utilize their GI Bill in a way that was helpful, but then also you weren't wasting time taking prerequisites or colleges that accepted Army credits, so they could get their degree faster. So it was an interesting job. Working for the Army is no joke. A lot of rules.
Yeah, I could imagine. That sounds very interesting. How long were you in this role?
So I did that for think 2009, 10, 11, 12, 13, 14. And I did it at Germany. I was in San Antonio, Fort Sam Houston for a little bit, and then Fort Carson, Colorado. Okay. So it kind of.
Okay. Wow. How did you like know about this kind of position beforehand, or like did it just like pop up somewhere and you're like, oh, this is cool, I can do this?
I looked at jobs at like usajobs.gov, I think, and just applied for stuff all the time. That is that should be one of your podcast episodes, the government job process. I know it's a delightful. You got to do all those KSAs.
Yeah, I've done a couple of those in the last couple of months. Yeah, it's not enjoyable at all.
Not at all.
Yeah, definitely. So after this, you decided to get your Master of Public Health at the University of Florida. So why did you decide to get your Masters of Public Health as opposed to anything else? Masters of Social Work, Masters of, I don't know. But yeah, why Masters of Public Health?
It was I guess the best way is it's what I've been looking for all along. It just put a name on it. And I've always wanted to use my skills and talents to be able to help people. But I didn't know why or like how to do that the best way. So, it's like, okay, do you look at medical school or nursing school or any of those? It's like, well, my talents can rely in a different area. And it turns out that through different emergency events, whether unfortunately a mass shooting or a forest fire or a terrorist attack, I've been able to be calm. And I think that's what's also helped me during this past year is that I just try to bring a sense of calm to the people that work around me, the people that are above me, below me, and just work with everybody. It was just one of those things where I was like, okay, it's public health was general enough to make a difference, but then also specific enough that I could use my talents and skills.
Yeah, that's awesome. And that is one interesting thing about public health, I feel like, because when you go from your bachelor's typically into your master's, you get a lot more specific, but I feel like in public health, it's broadly specific in that sense.
That's a perfect word, because you're like, well, I got this concentration in epi, but then I've got this, and well, what about public health practice? Because I could do this. Yeah, I like that, because having that basis of epi or just knowing how to do a community health needs assessment is so valuable, because you can apply that to so many different grants or communities or whatever you're trying to evaluate.
Yeah, absolutely. So did you have a concentration? Well, you did have a concentration. What was your concentration at UF?
Yeah, so mine was public health practice. And then I took every extra epi course I possibly could because I loved Dr. Prinz. I don't know if you had her. She was great.
I actually didn't have Dr. Prinz for any of my classes, but since I was the president of the Public Health Student Association, I got to interact with her a lot. Yeah, and she yeah, that was a big surprise to me, to be honest. But that really helped my entire public health career, I'd say. And I'm hoping to get Dr. Prinz on in a couple of weeks also. So that'll be nice to have her. Yeah, definitely. You had some internships in your MPH. So you were health promotion and health education and epidemiology intern. So where was this for, and like how do you come across this internship?
So I was at Hamilton County Public Health, which is the county where it is Cincinnati, Ohio. So I worked mainly in their maternal child health and epi. And then I was working on a lot of infant mortality data. So I would do things with like healthy moms and babes, but then also do a lot of the evaluation criteria for infant mortality, because Ohio has a huge problem with infant mortality. We're usually in the bottom rankings of the United States, and we've got a pretty diverse population, and just the disparities between different races is not okay. And we've got amazing initiatives, and we've actually improved over the past 10 years. So it just shows that public health is working.
Okay, awesome. So you said that's in Ohio. So were you working virtually or?
So I did a chunk online and then I did a chunk in person.
Okay, that's awesome. Great flexibility right there.
Yeah.
Actually, which programming language did you use?
I use SPSS.
SPSS. Okay. Okay. And in your career, because people have been asking me this a lot, in your career, which one has come up the most, like SAS, SPSS, or R?
Um, I would say I've used R more recently. I don't think I've touched SPSS since like 2016. It's
Yeah.
been a while.
Fair enough. Yeah, I haven't used SPSS since my biostats class, my
No,
MPH.
I was like, I don't know if I could even run like a Fisher's exact test right now.
Yeah, don't ask me to do
No.
that. Yeah, great. Okay. So you also had another role, Meadows Park Community Center public health intern at the City of Colorado Springs. So what do you do in this position?
So yeah, so I worked with the 5210 program within their community center. So the way Colorado Springs is, it is very divided. It is like literally a highway goes through, and it's kind of like the haves and the have-nots. And in the Meadows Park community, it was the lowest socioeconomic status for Harrison School District. So they had pretty aggressive gang presence and issues with just general safety, but then also a lot of food insecurity issues. So I worked with the community center to conduct some health programming over their summer camps. So just making sure that kids had enough food to eat, that they were teamed up with local food banks, making sure that they had, just those right educational foundations. So we talked a lot about making sure that we knew how to make healthy decisions, if we could identify trusted adults in our life and who are they and what does that mean. And so just working with kids and again just listening. So that was a good. I ended up doing my MPH final project on Harrison School District. So that was, it was heavy and my heart broke a lot and I wanted to take all the kids home. Come with me. But yeah. So.
Okay. Yeah, and that's some real public health experience you got there. So thanks for sharing that. So you graduated and then you got this community health educator, EPC public health at El Paso County, Colorado position. So did you get this like right after you graduated or how did that look?
Yeah.
Yeah.
Yeah. So as soon as I got my MPH, it made me eligible to apply for El Paso County Public Health Program. And through actually Meadows Park, I had started to meet some of the health department people. And when I came in doing like nutrition and like childhood obesity programming, they were like, oh, you graduating soon? So it was again one of those opportunities where it's like you build those relationships, you make those friends, and they literally were like, hey, we are hiring now. And then as soon as I graduated, they were like, cool. So yeah, so what was designated to me was being a community health educator on the TEP team, and that's the Tobacco Education and Prevention Partnership, which was a very interesting program to work on because Colorado, I know that some licensure is still in the works, but at that time was one of only, I believe, 5 states that didn't license tobacco products. So there was really there was like FDA enforcement, but like, So people that were selling to kids, there was no penalty. There was no, yeah. So we, public health, worked together with community leaders because they had just noticed in their high schools tobacco use, and it was right around the time when vaping started to just explode. And vaping just became such a big issue in both the classroom and during recess, and they'd see it outside and at high school sporting events. They're like, no, we have to change this. It is just too easy for kids to access tobacco products. So we worked on policies with local municipalities first, and then we worked it up to the county level, and then a couple larger metropolis areas like Denver and Boulder had started passing. So and Colorado Springs as well on its way as well.
Okay, awesome. And what was the process like for moving that up into the different levels of I guess governmental influence?
I mean, it was a lot. People have no idea how hard it is to get to mobilize a community for one source, because at the end of the day, everything's important. But unfortunately, sometimes in public health, your grant dictates what those deliverables are. This is what you're going to care about this year. But we know it's all important. But we got a lot of pushback, especially from business owners. We were even approached at city council meetings with delightful individuals that were called the vape militia, and how they didn't want their products regulated. And I remember in a meeting, he's like, we're not designating anything. We don't sell to kids. Adults love it. That's what we're here for. Air flavored vape juice. What 55-year-old man is buying gummy bear, and he just kind of looked at me like, so yeah. So, and as we know, more federal licensure has come out, and company leadership has come out like, this was not our intention to addict children, but yet here we are. So it was hard. It was really hard. We had a lot of community pushback.
Okay, yeah, no, that makes sense. That is quite the interesting story, and I couldn't even imagine being in that room when that was happening. That'd been pretty funny. So you were in I think the same health department, and you got a promotion, I believe it was, to a health communication coordinator.
Mm-hmm.
So yeah, tell us how did you get into this promotion, and what did you do in the role?
Yeah, so when I had first started with El Paso County, a part of the TEP grant, we had to have certain events and speakers and media interviews, and some things were just delegated to me, and then other things just kind of naturally fell to me because that's where my skill set was. And the public information officer from the county was like, we're going to be adding a comms job. And she talked to me about it. And yeah, I applied, and it was competitive, but I ended up getting that job. But again, it's like having the support of your team, relying on those relations, both the requirements of your job, but then also making sure that you are competent in your work. And I think that that's just something I showed over and over again, was competence.
What did you do in this role?
So I served as the assistant to the public health information officer. So anything from health promotion, health education, coordinating any statements. And that's really where I started to get a lot of chops for emergency communication. So responding to disasters, responding to terrorist events, mass shootings. Unfortunately, in Colorado, when I was there, we had one mass shooting. So we were right, El Paso County offices are here. And we had a police officer and a nurse, and we had an individual in the waiting room that unfortunately were killed by someone who was protesting abortion. And yeah, it was very sad. But yeah, so we in Colorado, you really get your emergency communication skills pretty hefty, just because of the number of fires and floods and contaminants in the water or whatever the disaster du jour was. But yeah, it was an interesting place to learn. And I really, really loved all the people. They were amazing.
Okay, yeah, that's great. And it's always great when you can work in an organization where you have people that you enjoy working with. So that's awesome. After this role, you moved on to a health communication specialist at at City of Cincinnati. So you moved, I guess, back to Ohio.
Yeah.
So what? I guess how do you come across this role, or why do you want to switch in moving?
Yeah. So I moved Colorado, full disclosure, I got scenery. So I had lived so many places while working for the Army. I was kind of like, well, I'm just going to go home. And it was a very similar position to what I was doing already, but then it also added a piece of governance because I worked closely with the Board of Health. So I've really wanted to get into more of the policy side of public health. So that's how I found that job. And it was very challenging. Working, because now that I've worked for, the Department of Defense at the federal level, then I worked for a county, now I work for a city, and then it's very interesting to see who's involved with what and what needs a commissioner status approval, what needs a city council member approval. So it was a very interesting health department. And then at every health department I've been at, I've always worked with FAB accreditation as well. So that is always an adventure.
Okay. Can you talk about a little bit some of the things that you do see at those different levels, working in the different levels of government, or something that stood out to you?
Yeah, red tape exists no matter where it is.
Mhm.
That's for sure. I would say one of the things that really stuck out to me is that some government entities get a bad rap, but honestly, I have met some of the most hardworking people that really want good and really want change in this world. Unfortunately, some of them are just overrun with the bureaucracy and red tape it takes to get there. I think sometimes, especially in the US government, because I've seen a lot of change out of the German healthcare system when I lived over there, but we're our own worst enemy. We have the power to change the paperwork, change the process. And that's why I love public health so much is that QI process, you know, we can improve it. It can get better and it's within our power. I'm a big believer in things shouldn't just be, well, that's the way we've done it. So that's how we should do it. I'm a really proponent of those people that are working in government that are trying to change that status quo.
Yeah, and I appreciate that a lot. Because yeah, I do believe that they are your biggest enemy, and there are so many more that the government can do, but they just have all those red tape, as you said. S-
Mhm.
So before we move on to your roles at the Health Collaborative, I wanted to bring up the presentation I spoke about earlier when you came to UF to talk during my MPH, and you only used pictures when you did that presentation. So there's literally like I don't know if there might have been a couple of words on the slides, but I think it was just only pictures. So where do you get, I guess, the, I don't know, courage, experience, know how to do a presentation with just pictures, and like why?
Nobody likes to be read to when it's like the PowerPoint behind you with, and then you just read every word. I would rather people look at a striking image um, and hear stories because, in every culture on this earth, the oratorical history is just fascinating how stories are either passed down or told or shared in different ways, whether it's family, friends, communities. I've just always been a proponent of utilizing stories in my presentations because I think they make it stronger, but then I also think that they make them easier to remember or relate to. Because if you don't really identify with, oh, that graph is really like, if you don't identify, I just think there's so much more, there's people behind every data point, and people forget that. So,
That is true. That is true. And it definitely was very engaging. And I remember it now, when is that, like 2, 3 years ago? So that definitely is awesome. When did you start doing presentations like this?
I have always kind of leaned towards that way, just coming from the arts. and a communications background. I did an entire picture presentation for APHA in Philly. I don't want to say last year because this year was online, but the last in-person APHA. And there, I got a lot of comments of like, wow, like I had no idea like this was going to be this interesting, like, you know, how the titles have to be a little bit chunky. But yeah, I just always want to give people the tools and, you know, like those stories that have stuck out with me, like a woman stopping a class and telling me, you know, I just have a microwave is way more powerful to me than being like, in the food security chart, I shall show you the percentage of households. Like, yes, we need data as public health. We need it to prove and validate and confirm and improve what we do. But there's different ways to share that data.
Yeah, I like that too. And I think the qualitative data gets slept on a lot, and those stories and the other ways of collecting that information is slept on a lot. But I appreciate you sharing that. So thank you. After your role at the City of Cincinnati, you moved on to a senior manager, external relations, PIO at the Health Collaborative. So how do you come across this job?
So I had worked with the Health Collaborative, which is the office that we are in now, a little bit at the Cincinnati Health Department, and I really liked the breadth of what they did. I, at that point, had really only worked government jobs for the past decade, and I was like, I think I need a break. So I was looking for things where I could use those skills and talents, but then also helped people. And because of all the PIO functions I held in Colorado, I was able to bring that here and expand upon it. So the Health Collaborative it's kind of hard to describe, but it's basically like, think the Chamber of Commerce for health, except we've got both a HIE or Health Information Exchange, but then also we run the ASPR grant, which is the Assistant Secretary for Preparedness and Response. And that's the grant I now run today. So I run the regional cache of supplies. So what it's like to have a warehouse with gloves and gowns and N95s and tents and beds, and wow, what a time. So we've been emptying out that regional cache ever since the end of January. So yeah, it's been an interesting road, which led me to this position at this moment in our history.
Okay, awesome. So tell me a little bit more about the Health Collaborative. So you said it's like kind of like a chamber of commerce. So what do they try to achieve at the Health Collaborative?
So I would say the number one thing they try to achieve is just improving health and healthcare while decreasing spending across the region. So we work on a lot of grants. We have one called CPC, and that basically works with all the practice providers, meaning primary care, and just working on efficiency and individualized QI projects to make sure things, you know, things are making sense. We also work for have grants with like Medicare, Medicaid, and Office of Innovation that are like taking a look at FQHCs and making sure that people are going to appointments, and if they're not able to, are they presenting in the ER? Because then we also have the HIE side. And then take, for example, one of our neat programs is called the Accountable Healthcare Communities, is take, for example, John Smith, and John Smith presents in the ER 3 times in 1 month. We're going to send that provider that note, and then our people work with that provider and go, hey, what's going on with Mr. John? Well, Mr. John was, you know, paying for food on the table and not his insulin. So that's why he was presenting in the ER. So we work and we match you with programs that can help. So things like, is it food insecurity? We'll get you with a food bank. Is it finding a job? We will help you get with workforce, resume development, dress for success for clothes, like any of those things. So we take that piece and try to solve the need. And then we've got a lot of amazing data mines here that do a lot of the analysis for the region, so we can see as a whole how we are doing, how are we decreasing spending, how are we benefiting the patient, and then making sure that the health programs we have are aligned for what the community actually needs.
Okay, thank you. And what region do you guys work in?
So we are a very funky region. I will show you a picture because everybody's like, what is this? Because especially for a response, so Cincinnati is located in Southwest Ohio. So I've got Ohio, Kentucky, and Indiana. So Southeast Indiana, Southwest Ohio, and Northern Kentucky, which makes it really great when I have 3 governors and 3 sets of laws to try to figure out. It's a COVID response.
Yeah, keeps you on your toes, I can bet.
All the governments.
Oh, wow. Okay, that's awesome. I didn't know it was a cross-state effort, so that's awesome.
Mm-hmm.
That's really good. And yeah, we do need to find better ways and solutions to reduce costs and get health up, as well as connecting those people to all the resources and things that they need so they don't overutilize healthcare or whatever the case might be. So thank you for the work that you do.
Thank you.
So did you talk about well, I guess as a senior manager, like what specifically did you do?
So my main position was the promotion and health education for anything public health facing. So I worked with the Gen H program, which is systems alignment, policy changes, environmental changes, working on large scale projects like that, but then also making sure that public health programming and hospitals are communicating in ways that help each other. I then, on the flip side, on the public information side, served as the public information officer for all of emergency response and the Greater Cincinnati Disaster Preparedness Coalition. So that community, making sure that fire and EMS are talking with public health. We are kind of like the conduit for bringing everybody together. We may not be the experts, but we can connect you to who is.
Yeah, and that's what needs to happen, especially in 2020 and going forward. I feel like we need to have those. It's really crazy to me that public health departments and hospitals and saying they have no communication with each other, and there's no kind of collaboration to really benefit the population. It is wild to me.
Exactly.
Okay, so then after the senior manager role, you got promoted into an assistant director, emergency response and public information officer role that you're in right now. And so firstly, what made you want this role?
So I've always, ever since I got a bunch of my FEMA certifications, either through the Army or through health departments, emergency comms is just something I've always been both attracted to, but then also good at. It's not something that scares me. A lot of people shy away from that harder communication. I mean, every day I have to go on TV and say bad news. It's defeating, and you get the delightful comments online. But I know that, I just recently had someone slide into my Instagram DMs and say, hey, thanks for your story, because now I knew where to get a test. I had no idea that it was this easy. I had built this up in my head. Now I'm going to get tested regularly. Thank you for your information. I was just like, if I help that one person, worth it. So I guess I was just attracted to making that more specific, but still emergency and disaster response is still, again, such a big thing. And there's so many facets of preparedness and mitigation and response and recovery that, it's kind of one of those pieces of, again, being very, very big mind and not specific, but then also having at least a little bit narrower of a lane.
Yeah. Fair enough. So what do you do in this role? I know you said you manage the ASMR grant. Did I say it correctly?
Yeah, so it's the ASPR grant. So the Assistant Secretary for Preparedness and Response. So designated from the White House is ASPR funding, which feeds into what's called HPP, which is the Hospital Preparedness Plan. So it's a program that's all across America, and it's done based on your region. So in Southwest Ohio, this is the Region 6. So I'm responsible for Region 6 regional cash, and that's that kind of storage of all of the beds and the PPE and, you know, all those things that we would need to have in a mass casualty incident if that were to occur. But we've been handing that out left and right. But yeah, so running ASPR, and then within that, there are both requirements for HHS, but then there's also state Ohio Department of Health requirements as well. So right now we are still chugging through some of those deliverables, which are kind of hard to do during a pandemic because everybody's got a ton of free time.
Okay, awesome. And thank you for the hard work that you're doing. Let me just put that out there once more. I don't know if I said, yeah, I appreciate the work that you're doing, and just keep it going, because we need people like you at the front lines doing this kind of work. So what else do you do in your day-to-day roles besides, I guess, media, speaking to the media?
So right now it is making sure that the hospitals have what they need. So in our region, I would say there's a decent number of rural hospitals in addition to a large number of urban hospital systems. And sometimes based on, you know, COVID spread, some hospitals are, you know, getting overloaded. Some are doing okay. We have to do what is called load balancing across our region to make sure that, you know, take for example, if a mass casualty incident did occur, I would log into something called SurgeNet and make sure, all right, send this squad to this hospital, this one to this hospital, to make sure not one system is overwhelmed. And it's been a hard data set to look at just how full our hospitals are. So right now I'm working on a lot of public education around utilizing the right level of care for what that need is. Like if it's truly not an emergency, probably don't go to the emergency room. And you don't want that bill either. Like let's use a little clinic or a minute clinic or an FQHC or primary care. And if you don't have that, maybe it's an urgent care situation or whatever it is, but just reiterating that public message. Because public health, you know, we want everybody to get care and we want it to be good care. However, if our hospitals are tapped, it's not going to be good care. So we need to take those measures that, you know, we've been pounding. Wear a mask, social distance, wash your hands, don't do dumb things, don't lick handrails, you know, but all the normal stuff.
Okay, awesome. You mentioned earlier that you got like FEMA certifications. So how important have those been to your career?
Oh, well, for some required. So I have done, here's a fun work binder that I have to keep, and I have to keep everything. So this is 10 years of FEMA class. So I have to update everything. But what's cool is more recently, FEMA has started putting some of their 3-day in-person classes online. So I know that's not applicable to everything. Like one of the best courses I did a TEACS course, which is the Texas A&M School of Extension for Emergency Management. And that's like a week hard incident command training. And it's just like as many of those hands-on classes. There's a ton of grants out there for people when in-person classes of that caliber resume, because it's a lot of tight working together. But that having that background and having also the support at previous places I've been to have that professional development opportunities is absolutely crucial, because they're great to have on your resume. Classes, I wish had more pictures, but it's a lot of reading off PowerPoints because government. But maybe I should write my own FEMA class. Idea. But one of the things is like it gives you a good foundation, because no matter where you go, and I've lived in so many states and have been in emergency communication roles, it's the same language, it's the same acronym, and that helps so much when there's not a lot of time to go back and forth. You know the process, you know what needs to happen, and you know the methods that you need to do it. I know if I need to request something, I have to complete a 213 RR, and I know that the EMA, hospital, or health department will exactly know what that form is. So that helps a ton.
Okay.
And they're all free.
Are they? Okay, that's good to know. I didn't know.
And the in-person classes, like they will pay for travel, food, incidentals. Like sometimes you're sleeping in a college dorm, but it's free.
Yeah, that's some great tips there. And thank you for sharing that, because I did not know that. What is the coolest project you've worked on in your role as a freelancer?
I was like, one of my favorite projects that I said I would do. I did it on a freelance basis, but I don't know if it's technically freelance because I didn't accept payment for it, because that's just who I am. I did a series of photography for soldiers coming home from Afghanistan, and I would give their families those photos.
Sweet.
So can't charge for that.
Yeah, fair.
Oh God, I mean, you're just crying, you're trying to focus, everybody's the kids' faces. Yeah, I can't watch those welcome home videos too much. I've seen too many. And it's a blessing to be there, but it's also heart-wrenching to see. I've seen spouses come to unit welcome homes when they know their spouse isn't coming. So yeah, it's the heavy things that are carried in this country.
So where would you like to see yourself in the future?
Less tired. Not working 17 hours a day. I don't know. I get asked that question because right now we're all pretty tired, pretty burnt out, but still public health is the best decision I've ever made. So something, I don't know, hopefully less hours.
Fair enough. Hopefully a vaccine comes out and eases you up on your work.
We're supposed to get our delivery for our pre-position hospitals within, let's see, like 8 days.
Yeah, I think that's the same timeline in North Carolina too. Like they're getting
Merry Christmas.
vaccines. Yeah. So
I know we're all going to be working on Christmas Eve vaccines.
Awesome. So moving along to the last part of the show, the Furious Five questions asked all guests.
Okay.
Number one, what advice you to give to a student trying to pursue a career in public health?
Don't be afraid to ask questions. I know when I was younger, I'd be always so hesitant, like, oh, I don't want to bother that person, but that sounds cool. Ask the question. People love talking about themselves. Come on.
Absolutely. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Definitely take advantage of those free online FEMA courses. So there's so much education, and I'm happy to provide you with links as well. But that just provides such a good foundation that is sometimes required for the job, but then also can complement some of your emergency management classes throughout your MPH.
Okay, awesome. And yeah, I definitely love the links to those.
Perfect.
Number three, what's something that you're working on improving in your life right now?
I'm trying to say no. And that is, as a woman, hard. As a people pleaser, hard. Just personally and professionally, like, because I'll get asked to do presentations a lot. But at the end of the day, I'm pretty burnt out. I'm pretty tired. For the first chunk of this pandemic, I worked over 140 days without a day off. I maintained 15 to 17-hour days, and I had lost so much weight, it was unhealthy. And it just got to the point of like, I literally advocate for healthcare for everyone else, and why not me? So just taking time to say no and know that it's not always a bad thing to say no.
Yeah, absolutely. Yeah. Thank you for sharing that. Number 4, professionally, do you recommend anything besides the female courses?
I would say keeping in touch with people from previous jobs. You never know where life will take you. So I would say never ever burn bridges and always make sure to maintain those relationships. I mean, if you had a cruddy boss, well, maybe just leave them to the side. But the people that you do like from previous positions or people that you connect well with or have a mentor relationship with, hold on to those.
Yeah, awesome. And last but not least, where can people connect with you?
Oh, I will give you my Twitter and my Instagram and my LinkedIn, all those
Okay,
places.
okay, awesome. Just give me the handle for your Twitter and your Instagram.
So my Instagram is capture.health because, health photography, here I am. And then I also purchased the domain of capture.health. Did you know that you can buy a .health?
I
That's
didn't
so
know that.
fun. Yeah, you
Really?
don't always have to buy a .com, so I bought that, and that'll take you to my photography portfolio that I haven't updated in like 5 years. Uh, but then I think my Instagram, I'm like, what is my Instagram? I think my Twitter is just my name. It's just at Christa Hyson, and it's Christa with a CH.
Okay, awesome. And I will link all of those in the show notes for anyone that wants to connect with Krista. So thank you so much for taking your time and saying yes to this one interview and being able to share your
Yes, for you.
insights. I appreciate it. Because I think it's just so important to have these conversations, and especially with your background, like coming from a non-traditional public health undergrad, and well, yeah, you know what I mean, and
Yep.
coming into public health, I think it's just an eye-opening thing, and a lot of people don't know about public health, but I feel like there's so much potential for so many people to do so many different things. So thank you for sharing your story today.
Thank you for having me.
Yeah, my pleasure. Okay, take care. Well, thank you so much for tuning in today. I appreciate you all listening. I appreciate you taking your time to tune in. And definitely don't forget to subscribe, leave a review, like, share it with a friend, comment. And yeah, I will see you all next week, and hope that everyone is doing well and staying safe and taking care of themselves. Public Health Millennial out.